Which nerves are responsible for the sensory function. Now let's talking about muscles and deep fascia. You know that. In the body, after skin and superficial fascia, we have deep fascia. And deep fascia covering the muscles. They attach the muscles, covering the muscles. Then you can see the muscles. Look at the deep fascia of the thigh. This picture, this white, milky layer, here you can see white or milky layer. Here you can see, this is deep fascia, like socks, like socks. It's here, deep fascia. Deep fascia covering the muscles, okay. Deep fascia in the thigh, it has name. Deep fascia in the thigh, we say fascia lata. Deep fascia of the thigh, we say fascia lata. So when we say fascia lata, it means deep fascia of the thigh, this region. Fascia lata. Covering all part of the thigh. Anterior, medial, lateral, posterior side. Okay, fascia. So why deep fascia is important? Because covering the muscles, and it has two important structure I will tell you. One, you can see one foramen in the fascia lata. In the fascia lata, you can see a hole. You can see a foramen. Look at here, this one. This fascia, deep fascia of the thigh, deep fascia of the thigh, fascia lata. It has a foramen, and the name of this foramen is a saphenous opening, or saphenous ring, or saphenous foramen. Why it has this name, saphenous?
Saphenous nerve.
Saphenous nerve?
Yes.
Yeah, saphenous vein. This vein, vein is saphenous. Let me ask you one question from the upper limb to check your knowledge in the upper limb. What are the superficial veins? What are the superficial veins in the upper limb?
Cubital veins.
Okay, two veins. Again, what are the name of the superficial veins? You know that in the body we have two types of the veins, right? Some veins are deep inside of the muscle, like artery, inside of the compartments. But other veins are superficial. Superficial means sathi. After skin, look at my hand, you can see some vessels. For example, in the neck of some people, you can see this, or usually athletes, you can see veins in the hand. What does it mean? It means they are superficial. Why? Because after skin, you have this. It's not deep. You can see easily. So we call them superficial veins.
Cephalic.
Very good.
Cephalic.
Basilic vein and cephalic vein, they are superficial veins. One here in the lateral side of the upper limb, cephalic vein. One here in the medial side, basilic vein. They have a connection here in the cubital fossa. Median cubital vein. When you want to take blood sample, when you want to inject, for example, something in the vessels, you use superficial veins. You don't use artery, no. Artery has a lot of blood pressure. You don't use deep vein or artery. Why? Because they are deep. You can't go inside of the muscle and find them. You use superficial. For example, you can see some angiocats they put on the hands here, because these are superficial vessels. These veins here superficial. So we have two superficial veins in the upper limb, cephalic and basilic veins. In the lower limb, again, we have two superficial veins. Look at the picture. I told you, this is deep fascia. Deep fascia covering the muscles. Deep fascia covering the muscles. Fascia lata. Look at this vein. It's outside of the deep fascia. It's superficial to the deep fascia. it means this is superficial vein, because you can see that easily. If it was deep vein or artery, it should be inside of the muscle. But no, it's superficial. This is great saphenous vein. Great saphenous vein. It starts from dorsal side of the foot, goes up, goes up, goes up, goes up, finish here. And this foramen, this opening in the fascia lata is for this vein. This vein from superficial part goes deep. Okay, so the name of this foramen is saphenous opening. Yes, we have saphenous nerve, I told you. From femoral nerve is here, medial side of the knee and medial side of the leg. Let me show you again. Yes, this one, saphenous nerve. Sensory nerve for the skin of the knee and leg. Okay, no, but that one is saphenous vein. This one, great saphenous vein. Okay? So, let's check again. I told you, the deep fascia covering the muscles in the lower limb, this picture is deep fascia. In the thigh, it has name. We say fascia lata. This deep fascia has one foramen, saphenous opening. Which structure passing from this foramen? Great saphenous vein. Great saphenous vein. Passing from this foramen and attached to the deep vein. Look at that vein here is very deep inside. So finally, all of the superficial veins, finally they finish in the deep vein. Because they want to go to the heart. So they should finish in the deep vein. Okay? So this is the first point, you should know that. Another saphenous opening, this one. This opening in the fascia lata is saphenous opening. And great saphenous vein, this superficial vein, finally go deep and attach to the deep vein, femoral vein. Attach to the deep vein here, femoral vein. Okay, saphenous opening. Another structure in the fascia lata is iliotibial tract. Iliotibial tract. Look at the name. Ilio, again, iliac crest here. Ilio. Tibial. Tibia is here. This big bone in the leg. Yes. Iliotibial tract. What is the meaning of tract? No, tract. It's correct, but not the exact meaning of tract. Tract like a stone? No. Like a vein. In Farsi we say masir. Talib, yes, it's like this. You know, you studied neuroanatomy.
Yes. In this semester.
In this semester you have neuroanatomy.
Yes.
You start that.
Yes.
You studied the spinal cord.
Yes.
Inside of the spinal cord, Dr. Ibrahim didn't tell you about tract. A spinothalamic tract.
Yes.
Rubrospinal tract. Corticospinal tract. Look at the name tract. Yeah. Tectospinal. Yes. Tract means vein. Tell you, yes. I can't understand what you say, but yes,
Yes.
it's same. Tract means vein. So when we say iliotibial tract is here, from iliac crest, this part of the hip, you know, iliac crest, one band, okay, comes down, attached to the tibia. From here, iliac crest, one band come down, attached to the tibia. Iliotibial tract. So why? What is the reason? This, look at the fascia lata again. Look at the fascia lata again. Deep fascia of the thigh, fascia lata. Lateral side of this deep fascia is very strong, very thick. Okay? What you say in Arabic to thick? Zahim? Samik? You don't say zahim? Okay, it's very strong. Okay? Look at here, look at the lateral view. This part, you can see that. When you extend your knee, specifically in bodybuilder, in athletes, you can see this part is very thick and very strong. You can see a band here. But when you extend your knee, you can touch that. Here is very strong and thick. This tract is iliotibial tract. So what is the reason? Why fascia lata here has a tract, and the name of this tract is iliotibial tract. I will tell you why. Two muscles attached to this tract here, iliotibial, two muscles attached to that upper part. Look at here, gluteus maximus in the gluteal region, and tensor fascia lata. These two muscles, one, gluteus maximus, attached to this tract, gluteus maximus, big muscle in the gluteal region. Another one, tensor fascia lata, this muscle. These two muscles, 1 and 2, gluteus maximus and tensor fascia lata, attached to this tract. So why? When they, do you know what is the meaning of tensor? Fascia lata is fascia lata, okay, deep fascia. What is the meaning of tensor? Tension, what does it mean, tension?
tension يعني توتر ما أعرف.
Tension, yes, tension. Okay, it's tension. When, for example, you straight something, this is tension. Make pressure. Tensor, fascia lata. Tensor means pulls. Push, okay, pulls. Tensor fascia lata, it pulls fascia lata up. So what is the function of these two muscles? Gluteus maximus and tensor fascia lata, why they attach to the iliotibial tract. When you extend your knee, support the knee. It's lateral side of the knee. When you extend your knee, this tract support the knee. What does it mean? The knee don't go right and left. Look at here. When you flex and extend your knee, always is open and close. Never it go right and left. Sometimes it go in some damage in football, in any sports. Maybe you have very bad damage in the leg or in the thigh. The knee goes this. It's very dangerous. Do you know why? What happens after, for example, imagine your femur goes medial, your tibia goes lateral. This happens.
And the tendons?
Very good. The ligaments has rupture, are cruciate ligaments. What salibi is inside. When you have this damage, so you have rupture of the cruciate ligaments. Rupture of the robot salibi here. So they should go to the surgery, they correct that, and it's very bad injury. Maybe they need 6 months, 9 months, go to the rest and recovery. So it's very dangerous. So the function of this tract, protect the knee from lateral side for any bad displacement. Okay? So in the fascia lata, we have two structures. One foramen, one opening, I explained for you, and one tract, iliotibial tract. This tract, two muscles attached to that, gluteus maximus and tensor fascia lata. What is the function? Stabilize the knee.
Stop.
Stabilize, make it stable, protect it, stable. Okay, what you say in Arabic to stable?
مستقر.
Make it stable, fix. Okay, stabilize the knee joint. During the extension and flexion, when you extend and flex, when you walk, this tract always protect the knee joint constantly during walking and running. So, I told you in the thigh, you have 3 compartments. You have 3 compartments. Anterior compartment, posterior compartment, and 1 medial compartment. So we have 3 compartments, anterior, posterior, and medial. We have just one bone in the thigh. When you cut here, just you can see one bone, femur. Just you have one. Okay. Which compartment is bigger?
Anterior.
Anterior, yes, because the muscle here is very big. Anterior compartment, you can see that. The biggest. Posterior and medial is smaller than anterior compartment. You know that between compartments, each compartment has a specific function, a specific artery, and a specific nerve. I told you, what is the nerve for anterior compartment?
Femur.
Very good, femoral nerve. For anterior compartment, the nerve is femoral. What is the nerve for medial compartment? I told you.
Medial.
Sensory. Medial cutaneous, lateral cutaneous. Cutaneous is sensory.
Operator.
Obturator, very good. Medial compartment is sense and motor is obturator. So guys, you can see that anterior compartment for the muscles, the nerve is femoral. And also it has some sensory branch. Medial compartment for the muscles and for the skin, the nerve is obturator. What about posterior? Posterior is not from lumbar plexus, it's from sacral plexus. I will tell you, sciatic nerve is very famous nerve, sciatic nerve, okay? So posterior compartment, the nerve is sciatic nerve. So we have 3 compartments, each compartment has a specific function, and each compartment has a specific nerve. Anterior compartment, femoral nerve for the muscles. Medial compartment, obturator nerve. Posterior compartment, sciatic nerve. So, which structure divides the compartment? Anterior from medial, medial from posterior. We have some septums. Septums, they are like valves between 2 compartments. We get here intermuscular septum. These are these lines. They're coming from deep fascia and attached to the bones and divides the compartments. Intermuscular septum. This is medial intermuscular septum. This one lateral intermuscular septum. This one posterior intermuscular septum. So compartments separates by these septums. We have a triangle and canal. Let me tell you what is femoral triangle. So look at the thigh. Look at the thigh in this picture. Upper part of the thigh. When you look at the upper part of the thigh, you can see a triangle. When you look into the upper part of the thigh here, you can see a triangle. You can see a triangle. So, what is the name of this triangle? Femoral triangle. The name of this triangle is femoral triangle. So, why this triangle is important? Let me tell you. Inside of this triangle, you have 3 big structures. Inside of this triangle, you have 3 big structures. No, muscles is the wall of the triangle. When we say triangle, like this for example, muscles making this triangle. But when we say what we have inside is other structure. Look at the picture. This one is number 1, nerve. This one is number 2, artery. And this one is number 3, vein. So from lateral to medial, you can see 3 structures in the inside of the femoral triangle. Femoral nerve from lumbar plexus for anterior compartment, it's here. Femoral artery, femoral vein. They are deep inside of the muscle. Okay, they are not superficial veins. They are deep because you know that deep vein, they are close to the artery. They have same name. When you say femoral artery, you have femoral vein. They are deep. When you say, for example, brachial artery, you have brachial vein. They are deep. But superficial veins, they are alone. They don't have artery. So these three structures, femoral nerve, femoral artery, and femoral vein, they are inside of the triangle. So the contents of the femoral triangle, femoral nerve from lumbar plexus, femoral artery, I will explain for you what is the origin. Femoral vein, femoral vein. Femoral branch of the genitofemoral nerve. I told you we have one nerve, genitofemoral, for genital system, and femoral is here, okay? And some lymph nodes, like axilla. In the axilla, we had a lot of lymph nodes. Here, we also have some lymph nodes, deep inguinal lymph nodes. So what is this triangle? Why we can see this triangle? Look at the picture. This is the point, it's very important. When you see the thigh, all part of the thigh, you can divide it to the three parts. When you see the thighs, you can see three parts. Upper part, upper 1/3, middle 1/3, lower 1/3. So, upper 1/3 is here, middle 1/3 is here, lower 1/3 is here. In each part you have one structure, one shape. In upper 1/3 you have triangle. So triangle is here. In upper 1/3 of the thigh. Upper 1/3 of the thigh. In middle 1/3 of the thigh, you have a canal. You have a canal. In middle 1/3. And in the lower 1/3 of the thigh, you have this fossa in posterior side. Okay? So, what is the name? Upper 1/3. The name of the triangle is femoral triangle. Femoral triangle here. Upper 1/3. In the middle 1/3, the name of the canal is adductor canal. I will tell you. Adductor canal. The muscle in the medial side of the thigh is adductor muscles because they can do adduction. Between these muscles, we have one canal, and we say adductor canal. And finally, in lower 1/3, you can see a fossa. What was the name of this fossa in the upper limb? In the upper limb, we had fossa here. Cubital fossa. Similar to this fossa, in the lower limb, we have one fossa behind the knee. Popliteal fossa. So this is popliteal fossa. I will tell you. So femoral triangle is here. Why we can see triangle? Look at this picture. Look at this ligament. This ligament is very important. This one. Between ossis, anterior superior iliac spine here, between ossis, and pubic tubercle, here is pubis. We have a ligament, inguinal ligament. So this ligament here, between ossis, anterior superior iliac spine, and this part, pubic tubercle, the name of this ligament is ossis. Excuse me, the name of this ligament is inguinal ligament. The name of this ligament is, this ligament is very important. Why? This ligament, this ligament is between the margin, the border between abdomen and lower limb. Here you say this is abdomen, lower part of the abdomen, but here we say this is thigh. What is the difference? This ligament. This one. Inguinal ligament. Inguinal canal also is here. Inguinal canal. I told you this canal between muscles attach the inside of the abdomen to the outside of the abdomen. So inguinal ligament is very important. And it's border between abdomen and lower limb. This is the base of the triangle. Look at the triangle. The base, the base is inguinal ligament. Borders, the base is inguinal ligament. Yes. Base of the triangle, This one is inguinal ligament. Lateral border is this muscle. What is the name of this muscle? Sartorius. The lateral border is sartorius muscle. This muscle is sartorius. I will explain for you in the anterior side. Medial side of the triangle is adductor longus. Adductor longus for medial side of the medial compartment of the thigh. Adductor longus. So this is the shape of the triangle. Base, inguinal ligament, lateral border, sartorius, medial border, adductor longus, triangle. Apex is here. Apex of the triangle opens to the canal, because in the upper one third we have triangle, in middle one third we have canal. So the apex of the triangle opens to the adductor canal in the middle side. Apex is directly downward and forms the point where the medial and lateral boundaries cross together. Apex is continuous to the adductor canal. After apex, you go to the adductor canal. What is the floor? What is the floor of this triangle? So some muscles, pectineus and psoas major, some muscles, they are making the floor, these muscles. Floor of the triangle. Content I told you. Femoral nerve, femoral artery, femoral vein. If I ask you, which structure is the most lateral structure in the triangle? So, sartorius, this muscle, is lateral wall of the triangle. But the question was, which structure is the most lateral structure inside of the triangle?
Nerve.
Nerve.
Femoral.
Which structure is the most medial structure inside of the triangle?
Femoral.
Artery. Vein.
Vein.
Nerve is lateral. Vein is medial. Artery is middle between them. These are wall. If I ask you, what is the lateral wall of the triangle? You say sartorius. What is the base of the triangle? You say inguinal ligaments. And we have some lymph nodes and nerves. Okay, guys? Femoral triangle is important because here we have artery, nerves, and veins. One question. What is the origin of the femoral artery? Tell me in the upper limb. What is the artery for the upper limb? What was the artery for the upper limb?
Subclavian artery. That brachial artery.
Subclavian artery. Subclavian artery goes to the axilla, we say axillary artery. Then goes to the arm, we say brachial artery. One artery. Subclavian artery comes to the axilla, axillary artery. Goes to the arm, brachial artery. What is the origin of subclavian?
Subclavian from the aorta.
Origin. Beginning of the subclavian artery, where is it?
Aorta.
Aorta, very good. In the left side is from aorta,
Yes.
but in the right side from brachiocephalic trunk.
Yes.
So now my question, what is the origin of the femoral artery? Very wise answer. All of the artery start from aorta, but not directly. You know that aorta, guys, look at here. Aorta has ascending aorta, aortic arch, descending aorta. Finally, aorta divides to the two branches. Iliac, common iliac artery. This is common iliac artery right, common iliac artery left. So aorta finish at the level of L4. Vertebral column at the level of L4, aorta finish. Into the two artery, common iliac right, look at here, common iliac right, common iliac left. So what happened after that? Common iliac right and common iliac left divides to the two branch, internal iliac and external iliac. So common iliac artery divides to the internal iliac for inside of the pelvis and external iliac for the lower limb. Look at here, common iliac divides to the internal iliac and external iliac. Look at the picture. Common iliac divides to the internal iliac for inside of the pelvis, for urinary bladder, for anal canal, for this structure, prostate, and one external iliac artery. External iliac artery goes to the lower limb. External iliac artery goes to the lower limb, and we say femoral artery. Look at here, it's deep to the inguinal ligament. This is inguinal ligament. After external iliac artery goes to the lower limb, we say femoral artery. It's enough for the first hour. If you have any question, I'm here. If you don't have any question, I will see you here again at 10.
Inshallah.
We will continue the theoretical part, this lecture. We're talking about artery again, nerves and muscles. And let me see how much we can go ahead today. Then we decide about tomorrow. For example, we can have 2 hours theoretical, 2 hours practical for the tomorrow. And the day after tomorrow, again, we have 4 hours. So I will see you here at 10, okay?